Hello everyone, and welcome to the third in our series of light sensitivity awareness podcasts. My name is Rodney Mountain, and I'm here today with Professor Sally Ibbotson and with Shannon, the parents of one of the patients at the service. We're recording from the Scottish Photobiology Service in the unit in Ninewells Hospital, and we're here today to discuss light sensitivity. This series of podcasts is a part of the ongoing patient engagement work that our service is involved in. We're trying to raise awareness of light sensitivity conditions in order to reduce the time that it takes for patients to be referred to our services and also to improve the lives of our patients. So do you mind if we just start with a few introductions? Shannon, would you mind just introducing yourself and your daughter and why you're here?
Yeah, so I'm Shannon and I'm the parent of Aria, and she currently suffers from polymorphic light eruption. So yeah, just here to chat about that, I guess.
Thanks very much. And we'll obviously get into things in a lot more depth and how this actually affects you and your daughter in day-to-day life. But we'll move across to Sally just as a quick introduction.
Yes, I'm Sally Ibbotson. I'm the lead for the Scottish Photobiology Service here, which is based here in Dundee, but it's the service that is offered Scotland-wide to all patients throughout Scotland for investigating and treating patients with light sensitivity diseases, including the very important cohort of patients who are children who present with abnormal light sensitivity.
You know, I know very little about these conditions, so it'd be lovely to hear from you a little bit more in detail about what these conditions actually are.
Yeah, well, so the service here has been here for 50 years. In fact, it's our 50-year anniversary this year. And it's in recognition of the fact that many people in Scotland and worldwide, in fact, suffer from abnormal reactions to sunlight. And there are a very widely ranging group of diseases, ranging from the very common disease, polymorphic light eruption, which ARIA has. So this is actually present in a fifth of the population in Scotland. So 20% of people living in Scotland will have polymorphic light eruption. And probably that is even a bit of an underestimate because many people will think it's just an odd sunburn or a reaction to a sunscreen. And it typically presents in young adult females. So, you know, the typical age to get it was a female in their 20s. But having said that, a fifth of patients with polymorphic light eruption will develop it as children and often even right down to babyhood. And there it's important to recognise it and make an accurate diagnosis because there are also a range of other light sensitivity diseases that can present in childhood, some of which have more serious implications. So it's very important that young children in particular are assessed to make sure that that is the correct diagnosis. As I say, there's a range of lots of different sorts of light sensitivity conditions, but the condition polymorphic light eruption that we're talking about today, we think represents a sort of slightly heightened immune reactivity of the skin when it's exposed to sunlight. So all of us have immune systems in our skin, and the normal reaction of our immune systems when they're exposed to sunlight is that the immune systems damp down in the skin. And in polymorphic light eruption, it seems it's damped down to a lesser degree. So what happens then is the sun reacts with a chemical or protein, something that we don't actually know exactly what it is, but causes this raised up lumpy rash and reaction. And in children, it typically presents and involves the face, whereas actually in adults, it more often involves other sun-exposed sites, such as the arms or the trunk or bits that are not exposed every day. So it's a condition where, particularly as people grow older, they can harden. So they'll often be really, much worse in the spring, early spring and early summer in this part of the world. And then as the summer progresses, they may be able to harden up and toughen up. And that's probably why children have it more on the face than adults with the same condition, because children haven't been able to harden to the same extent. We do sometimes find that people will often ask the question, because I've got abnormal light sensitivity or polymorphic light eruption, does this mean that I'm more likely to get skin cancer when I'm older? But there's actually been some studies done that show, even allowing for the fact that, you're more likely to be keeping out of the sun, but even if you allow for that variable, it seems that because the immune system is a bit more switched on in polymorphic light eruption, actually your lifetime risk of, say, skin cancer is probably less than somebody who doesn't have polymorphic light eruption. We only investigate the tip of the iceberg of people with polymorphic light eruption. Obviously, a condition that affects a fifth of the population, we couldn't possibly investigate and test, and it wouldn't be necessary in most people. So we will do the investigations when, for example, there's doubt about what the diagnosis is, or people have got very severe disease, or as in, Aria's case, she presented at a very young, tiny wee age. And there it's important, to rule other conditions in or out.
Yeah.
We have a range of different light testing things we can do. As you know, Shannon, from Aria's case, we also did sunscreen allergy testing as part of her workup because she has some allergy to some of the sunscreens. And often in people with light sensitivity conditions, because they're big sunscreen users, they can also get allergic to their own sunscreen. So that's another part of the testing that we did in Aria's case.
Yeah. I felt terrible putting her through that testing as a parent. I felt like because she was just so wee and watching her get the big machines and stuff, and then obviously the skin testing patches. I felt horrible putting her through it, but at least now I know.
Yes.
What's causing her reaction.
No, exactly.
So
yeah. And I think you highlight an important point there, because actually that's often something else that we're asked, can you test in babies or young children, tinies? And I always say it's the wriggle factor that determines how much testing you can do, not. So actually most children and babies we can do some testing on. The testing we usually do on the back. So, in an ideal world, you'd have a nice big adult back to do lots of allergy testing and light testing all at the same time. So if you're faced with a tiny 2-year-old, then testing you can do is much more limited. But we can usually do enough testing to get the answers that we need and to rule things out or rule things in. Sometimes it's almost easier to test a tiny 2-3-year-old than it is to do an 8-year-old if they're wriggling around. So it depends a bit on whether they're able to sit still. And the setup we have here, we have DVDs and they can be entertained. And
I loved that. She sat still and
exactly.
It was a few hours we were here.
Exactly.
No bother. She enjoyed it in the films as well. I can't even remember what she watched.
Exactly.
Yeah, no, it was good.
So we do aim to make it not at all an intimidating process.
Yeah, no, it wasn't. I was just worried. I just worry about everything. But,
and occasionally we do ask for a blood test and things, but I don't think in Aria's case we ended up doing that because there wasn't the need. We knew what the diagnosis was anyway. But the actual light testing side of things for anyone referred, it isn't a scary thing. We hope to explain it as well as we can to parents and mums and things before you come. But also, it's for adults, it's slightly boring. For children, it can maybe be slightly, what am I doing, having to sit still for all this time? So we do try and minimise that.
Yeah, no, that was good. Yeah, no, it was.
DVDs and things. Yeah.
She was totally fine with it. I think she found it fascinating that she got all that done to her, and everybody with all attention was on her. So
fab. And did she get her certificate and badge at the end?
Yeah, she did. Yeah, she was really happy with that. Yeah, she loved that. I don't know where she's put it now. But...
And Shannon, just going back, when were you first aware that there's maybe something was wrong, that it wasn't right, and then the journey you've been on from being a worried parent to
2.5? I just noticed that she was sitting in her pram and with the hood over, I would take her out. She wouldn't be out long. Maybe 10, 15 minutes at a push, and she'd be all swollen and red in the face. And I'm like, that's not right. So then we put sun cream on her, but then it would get worse. And obviously it took a wee while, and we did think it was maybe just a fluke, like virals and things like that. But then it kept happening, and then I was noticing the sun myself, and I was noticing when it was happening and when it was certain temperatures. And then I was noticing, I think it was my mum that noticed putting the sun cream on her made it worse. And then obviously I went to the doctor about all that, and it did take time for the doctors to sort of not realise that it wasn't just a viral, it wasn't just something else, it wasn't just sunburn. It took them a wee while to come around, and I did have to keep pushing at it to eventually be like, no, something isn't right. But yeah, no, she was about 2.5. Maybe I just started noticing.
And then what was the next sort of step, in that process? If you were worried, you went to your doctor?
Personally, I kept trying different sun creams and different hats, and made sure they were SPF. I made sure her whole body, because she would sometimes get it on her torso, and it did look like a viral. But I was like, it can't be. She only had it maybe a week before, and she's got it again. It can't be a viral. It kept continuously happening. So I tried different sun creams. None of them worked. She was just reacting more. But obviously now we found out that she's allergic to certain ingredients. But yeah, no, eventually it took about, I think, maybe 1.5 years before she eventually got sent here.
So she got a referral to the service here.
Yeah.
Going through that service, how did it all work?
It was really easy and quick. Once I put my foot down, essentially, I was like, no, something's not right. My doctor was like, right, okay, we'll refer her up. And it was done within a couple of weeks, and she was already up here getting tested. And getting the big machines and stuff. And it was scary because I was learning about what all these machines did. I didn't have a clue about SPF or UV or UVB. I didn't have a clue. So it was daunting for me, and I was worried about her being so small and these big machines on her little body. But then with me, I was worried about, is this going to do anything to her in the long term, getting these machines, these rays on her skin and her back. And I was assured that, like, it's totally fine, like, it's okay, like, she'll be fine. And sure, obviously she is fine. But in that moment, it was just pure worry, and I had nobody that I could turn to either to sort of get support from, because a lot of people are just like, oh, it's just sunburn, it'll go away, it's fine. But it wasn't. You know something's not right, is it?
A mum's intuition.
Yeah.
Once the diagnosis was made, what followed on thereafter? Obviously, she's been growing up and going through nursery, and she's in primary now.
One now, yeah. So once we got the diagnosis in, I then went out and tried to find things by myself of more information on it, because there isn't much about it. And obviously, with Aria being allergic to sun cream, I had to then go out and try and find sun cream that's suitable for her, that's totally organic, nothing in it, and that took months for me to find.
Which one are you using now?
The Badger sun cream. It's mainly like beeswax, and it smells like Terry's chocolate orange, so she does enjoy putting it on.
Oh, that's good.
So, but I think it's only SPF 30, but that's the highest I could find that's not got anything else in it that will make her skin worse. So yeah, that seems to be working. And then obviously I used she has the wide brim hats, sort of like the fisherman hats with the back end. She has them, and then she's got some clothing that is SPF protected. But then I'll also do the technique where you hold it up to the window and make sure that it's not shining through a material, if it's going to be a thinner top, or I check all that. And then say like if we're going on days out, I have to make sure that I'm going to know where there's shade. I'm going to know where she can get sort of a break from the sun. I was going to ask
just how it impacts your life, your things you do.
Well, before I was driving, I went and done my driving last year, so that, because I knew having a car would protect her more, because I remember there would be times over the years where we would be stuck at a bus stop and the bus didn't come and it's scorching, and that would be pure panic for me, because then I'm worried about her skin and I can't get her shaded very well in a bus stop. And by this point she was out of a pram, so she didn't have the shading from the pram either. So I did my lessons and stuff, and now we do have the car, and it has made life a bit easier for her. And that's probably maybe why she's not reacting so much. But when we're out and about, I just have to make sure that there's somewhere I can go and she's going to get shaded. And I know that, so say like with me and my friends, or Aria's friends are going to Camperdown, I'll have to say to them she can only maybe go, depending on the temperature, UV that day, she can maybe only go for half an hour and then we need to leave. So with things like that, that's when I notice it, whereas their children can stay out for a good few hours, whereas Aria can't. And Aria's also at the stage as well where she will wear her sun cream, but she's noticing that she's the only one in her class who has to wear it when it's not even that hot outside. So it's just little things like that. But our nursery, when I first got diagnosed, our nursery were brilliant. They put her sun cream on whenever she was out. And because of COVID, her nursery was outside most of the day. But they did obviously make allowances for Aria to go inside if needed. And then when that sort of lifted, she was able to just go in and out, but limited. And then they ended up building her sort of like
gazebo type thing.
Yeah, kind of, but sort of just like they made it themselves. Yeah. And there was lots of big trees where they made a den inside so that she got more shelter that way, so she could still be outside.
Great nursery.
Yeah, no, it's a brilliant nursery. And then obviously going to school now, we're kind of just seeing how that's going. With they've got the SPF window. I'm not entirely sure what they're called.
They've got window film on the windows.
Yeah, so they've got that on, and then they do have 2 days a week where she's going to be outside. But so far they're going to adjust that for Aria, and she'll only maybe do 20 minutes here and there. So I usually do 20 minutes in the morning and 20 minutes in the afternoon if it's sort of over 12 is what I go with. So kind of just do it like that. But if she's going to be out longer than that, then I make sure that they know that she needs to be in shade for a wee while and covered in sun cream. If there's any skin showing, cover it.
Yeah.
Make sure her hat's on and make sure her skin's covered if she's got like a long sleeve, like, because obviously kids, you know what they're like, they'll whip things off. And
you mentioned that the primary school are also going to continue to help put the sun creams on.
Yeah, they're going to continue to help, because I was worried about that, the fact that she's only 5, she can't put it, she can put it on a wee bit, but it's like, you know what kids are like, so they're going to help her put it on. And with COVID and stuff, I wasn't sure if they were going to do it, but they're happy to do it further, so which is obviously a relief for me.
Yeah, that sounds super. That sounds great, because we have had that where we've had nursery. I think the nursery schools are very equipped to put sunscreens on, but we have had in the past people coming and saying, oh, you know, my child went up to primary school and then they weren't helped to put their sunscreen on. So that sounds really good, actually. And is there any area of shade in the playground and things? Or
Yeah, they've sort of got, I don't know, it's like a roofing thing. It's like a roof, and then it's got, I don't know, poles coming down from it. And
Okay,
it kind of goes around the middle of her
Yeah.
playground bit. But behind her bit, where she's got like their own sort of garden away from the school, there's nothing there yet to sort of help her if she's going to be outside. So that's how I've said to them 20 minutes just now, and then bring her in, and that's it. Which
I was going to ask, what is the time frame where you notice a problem starts developing?
It depends on the heat of the day. So once it's over 12 and maybe goes to like between 12 and 16, I'll maybe give her half an hour at most, but with sun cream on and a hat on. Anything over that, then I start just knocking it down and just taking it from there.
So when you say 12 and 16?
Celsius, the temperature, I kind of, and then it depends on the UV as well. I'll look at that too. I'm still learning too, so at the same time, I'm sort of testing her time-wise. So I'll give her 15 minutes and I'll bring her back in, and then I'll just see how she feels, because she's now started saying to me that, Mum, it's nipping my skin. I can feel it hurting my skin.
And does she get those symptoms straight away then, or is it a bit later that day?
No, sometimes it'll either be that night or a few days later.
Oh, right. I didn't realise that there can be that lag.
It's not instant. Like sometimes you'll see it here. You'll see it. I could see it starting.
And you mentioned that you said it looked viral. Can you tell us a bit about what that actually looked like to you?
Just like your normal, say like, it wasn't full-blown coverage, but like just a normal sort of rash you would get if you did have a viral. It just looked very similar to that.
Was it like a spotty rash, or?
Yeah, it was just like single ones.
And any fluid in it, or?
No.
And how long, when that's triggered, how long will it take to disappear?
Maybe about a week.
Okay.
A week. I think it varies on how badly she got it. So in the beginning, before all the testing, it was last a good while. Whereas now I think, because I'm more aware of how to protect that and know to keep her out of it and not put her back in the sun or just anything like that, then I don't know if it's helped reduce it. But there's also been things, I remember reading online, that tomatoes can make you sort of more sensitive to the sun. I don't know whether or not that's true, but I started cutting down on them with her because she loves tomatoes. Anything tomato-y, she'll eat it. So I started pulling back on that. So I don't know if that's
the wee bit of evidence tomatoes might actually protect you a bit.
Oh, okay. Well, maybe. Well, that's just little things that I was just trying. That I've read myself, and I'm just trying to figure it all out. And
does it leave any scars or marks, or does it just fade away?
She has had scarring. She's had scarring on her cheek, and she's got 1 or 2 on her arm scarring. But that's from her then picking it.
Okay.
It's not so much like if she left it alone, it probably wouldn't have. But she goes back and picks it.
And is it itchy?
Sometimes, not all the time. For all I know, it could be itchy, and she's just not told me that it's itchy, especially when she was younger. So, touch wood, she's not had it this year so far.
She's not had it at all this year.
No.
That's great. What month will she get it up until? And does she become less sensitive as the summer wears on, or?
Yeah, I think so. So I noticed it like years ago. It would start about March, April time, and it would be ending over 12. That's how I always stick to 12 now, because that was obviously the lowest that it triggered with her.
Yeah.
So I stick to that, 12 Celsius, and then it's usually about maybe now, August, September time, nothing. Like, she seems to be okay.
Yeah.
And obviously before all this, I didn't even know snow could cause it too. I never knew that either. So obviously, winter last year, she was fine. She was okay. So I guess hopefully this year in the winter. New things that you learn. I didn't think of snow being sort of the reflection.
And you mentioned about the sunscreen. It's probably just worth the mention there. So you're actually far better to use an SPF 30 that you like and she likes, and you'll therefore put on properly, than us saying go away and use this factor 50 if it's claggy and you don't like it and she doesn't like it, then you won't use it properly. But it is just not so much for the polymorphic light eruption, but just for sunscreen protection against sunburn in general, that people will often think there's such a thing as a sun block. But there is no such thing as a sun block. If you want real sun protection, the best things are shade and hats and clothing. Yeah. And then your sunscreen on the bits you can't cover. But actually, for any given sunscreen, that number on the bottle, so say a factor 60, in reality, divide the number by 3 or 4. So your factor 60 will probably be about a factor 20 protection in reality. Because there have actually been several studies done that have shown that nobody can actually use sunscreens to the level that they were used in the trials to get the testing done for the factors, and that actually there was some research studies done where people have gone off to Tenerife and checked how we all use them and things, and we use them about a third to a quarter of the amount to get the real level of protection.
The thing is with ISO, you have to obviously consistently keep putting it on. You can't just put it on in the morning. Like when I was younger, my mum would just put it on us in the morning and maybe later on.
Mm-hmm.
But with Aria, depending on the day, or the heat, or the UV, it need to be consistently keep getting put on.
Yeah.
I think every hour I've done it, I've always put it on it. And if she's been in the pool or anything like that, she's straight back out and it's back on.
Back on it. Yeah.
And sunscreens are so much better these days. There is a sunscreen out there for everyone, really, that will like the consistency and the formulation, etc. But I think in Aria's case, because she did have these reactions to the sunscreens on the testing. So I think one of the chemicals was something called octocrylene, wasn't it?
Yeah, ethyl hexyl.
Yeah.
That's sort of how I remember.
So octocrylene is the commonest sunscreen allergen in children, actually, but it is actually present in lots of sunscreens. So if you pick up a sunscreen off the shelf from Boots or something, actually there's probably 5 or 6 sunscreen chemicals in that
none
sunscreen.
in the shops. I went even online, they all had it in it.
Yeah.
That's how it took me a good wee while to find the Badger one when there's in it. But I also noticed the octocrylene, ethyl hexyl, and there's another name for it as well. They're not just in sun cream.
No.
They're in hand soaps, in shampoo,
facial
makeup.
moisturisers, makeup.
I had to change my makeup because obviously she would touch my face and then she'd get itchy and it's in a lot.
Yeah, because sunscreen chemicals are often things like, your shower gel on a bathroom shelf.
Yeah.
So they're in those products to stop the product degrading from sunlight when left on the bathroom shelf, sort of thing. So
I learned so much from these sessions.
so sunscreen allergy is a bit of a minefield, and you do have to feel like you're in sort of CSI doing a bit of detective
I always say
work.
to people, like, I feel like I need to be a scientist to sort of understand all this. And I mean, still now I don't understand a lot of it, but I'm still learning every day what I'm...
And the other thing to be aware of with sunscreens, I mean, it can, as I say, if you go into Boots or Superdrug or a supermarket, you'll see shelves and shelves of sunscreens. Which one do you choose? But the other thing is that actually, if you choose one formulation of something, then by the following year, it can have subtly changed again. So it's always worth just double checking on the ingredients. The good thing is they all do have their ingredients. They have to say what's in them.
Well, you've been on quite a journey. What's it been like for her? How's she coping with it?
She copes okay with it. There has been times where I was worried it would affect her mental health or anything like that, and I noticed that she used to get left out of a lot of things, and that was quite upsetting. So her nursery were brilliant, but obviously there was times where Aria couldn't participate, and that really, really upset Aria. But it was just things like that, or for example, when I mentioned if we go to the park with friends, we have to leave. Like, we can't stay there all day with them. It's things like that when she's like, no, and she gets so upset about it. Or if her friends point out, like, why have you got sun cream on? We don't need it. But other than that, she does do brilliant. I think she's more resilient than what you give them credit for. Do you know what I mean? Like, they just have their moments about it, I think. So.
And has she got some nice pals?
I think she's got one new one just now, because it's only been about 2 weeks since it started.
The same group moved from nursery to the school?
No, Aria's the only one that's went to...
Okay, so she's making new pals.
She's completely on her own there. So yeah, she's away from all her friends that were at nursery. I remember I would see them, they would run up to her like, why have you got sun cream on? And I'd just say, it's hot today, Aria just needs it.
Yes, because children at that age are quite harsh. They'll just say it as it is, won't they?
Yeah, they can be. So it's just wee things like that, I think, that affect her. But she's getting good. Like, on the car, I've got SPF.
Window film.
Yeah, I've got them on the car. And ones that stick on, I've got them ones just now. And if that falls off and I've not noticed, like, she's quick to say, Mum, that's fell off, put it on, if it's a really hot day. If it's raining, it's not too bad. She doesn't bother too much when it's raining. But yeah, she is good. Or, Mum, you forgot my hat. Or, Mum, my sun cream's not in my bag. Yesterday we were at our gran's and she went to go and wash her hands. And I was speaking to my gran and I never thought to check, and I usually do. She's like, Nanny's soap, Mum, you need to check it. So she's getting to the stage where she's recognising that she can't use certain hand soaps and to check it first. Which I suppose is a good thing. Like, because there will be times where I've forgotten, and she is good though.
Yes, I think the whole thing with children is, isn't it? It's trying to do the best that we possibly can to support them not being different in any way from their friends, or not being seen in any way to stand out, particularly as they get older and they go through primary school and things. There's lots of, well, I don't want to wear that. And, children as they get older do want to just be like everybody else and not have to wear a sun hat or not have to.
I think as she gets a bit older, I think that's maybe when it'll start maybe to affect her more, when she does still have to wear these hats. And
I was going to ask, and I'll probably ask Sally that question, just the longer term journey that Aria's on.
Despite it being extremely common, the long-term studies are not really that well sorted out in terms of...
She can grow out with it.
You can, yes, she can. So definitely at least a quarter of people it does resolve in, disappear. And most people, once they know what it is, do find they're much better able to cope with it and deal with it.
Yeah.
It is a condition where, as you get older, most people can also do what we call harden. So it is a condition where getting low-level exposure below levels that will trigger your rash on a repeated basis
that's what
can
I've pretty much
protect
been
you
doing.
from
She'll
getting
go out for
it.
10 minutes, 20 minutes
Lots
at
of
a time
small-
and back in.
Yeah. So we have had many patients who've had it quite badly in childhood who actually who've gone on and may still get a tendency to, if they're caught out, they may get a bit of rash, but actually are able to deal with it. So I think in the longer run, the hope would be that she'll be able to harden and become tolerant of it.
I have
She's
heard
fine in the winter time, is she?
Yeah, there's nothing. Even like before she was diagnosed, it was the winter time was okay. It was only around the summer months, but I think she will, as she gets older. I think with the hardening and things like that, I think it will get a lot, because there is a lot. I'm part of like Facebook groups and that, but it is mainly adults that are on who suffer from it, and I've noticed that obviously Ari is lucky in the sense she's nowhere near as sensitive or as bad as what others are, so we are quite fortunate in that sense, because some of the things that I've seen online, and it's quite sad, like I've seen people covered head to toe, and if they go outside the half day, it doesn't matter the temperature, it doesn't matter the UV, and it must be quite hard.
Yeah, and I think you're doing absolutely the right thing, because we really don't want you to completely keep her out of this.
No.
We want her to live as normal a life as possible. And we want her, actually, the worst thing to do is to completely stay out of it, because then you're more likely
Then you get a
caught
big
out
reaction.
Yeah, exactly.
Yeah.
And you mentioned about the window film and things. So just as a word on that, so normal window glass blocks UVB, basically, the sunburny bit of the sun, but it lets through UVA.
Yeah.
And in the car, for example, the laminate in the windscreen blocks all UV, but the side windows will let through UVA. And UVA are wavelengths of light that can quite readily trigger polymorphic light eruption. And so if you have a particular problem in a car, so say, for example, you're an adult and you drive for your living and things, and you're caught out all the time, there is window film that can be put onto the side windows of the car, or can be fitted in the home, which actually it's legal for driving because it doesn't obscure, visibility at all. In fact, there's on this window here, it's fitted.
I asked
and that
about that, and
all
it can
UV.
be quite expensive to be done on cars. So that is, like, it is for some people, it won't be an option for them.
Yeah.
Because even I remember before I was working, even the price of sun cream
I know,
is very, very dear. So for someone who may be in a similar situation to me, who may not be able to afford to pay £30 a bottle, and the bottle doesn't last long, especially if she needs it on all the time, like the pricing of things can be really bad. So then parents can then be stuck in a catch-22, whereas they can't afford to get the child specifically what they need.
No, you bring up a very important point. So at present in Scotland, if you have a light sensitivity condition diagnosed, you are entitled to sunscreens on prescription, but there is essentially at the moment really only one sunscreen that you can actually get on prescription. And the availability of that, in recent years, the availability of it seems to come in and out of being able to get it on prescription. So it is a challenge. The window film, unfortunately, is not available on prescription and does have to be purchased and fitted, and it might cost between a sort of £100 to £200 to get your side windows and things done on your car, depending on where you get it done. Most people with light sensitivity won't need the window film. They would only sort of suggest that if there was a particular instance where, say, people did say, well, have trouble in the car or have trouble at home, and you know that they've got UVA sensitivity, for example.
Yeah.
Ari's testing was normal, wasn't it, when she came with the light testing?
I think that was normal.
And so in polymorphic light eruption, actually 2/3 of people, the actual light testing on the back to the individual wavelengths of light is normal. Only 1/3 will have a bit of abnormality and sensitivity on the testing. And we do sometimes try, we wouldn't have done it in Ari because she's a bit too young, but sometimes in adults we'll try and provoke the rash with a bit of UVA light. But again, we'll often not manage to do it. But actually the diagnosis of polymorphic light eruption really is much more emphasis on the story. We can usually tell, okay, this is what it is from the story. And the testing is to rule other things out more.
Yeah.
That's been so interesting. Are there any other things we've missed from either side, from the clinical side or from how it affects you and Aria in day-to-day life?
It's just the whole, it is obviously she can't be like a normal kid all the time. Like she just can't be out all day out. Like obviously when we were younger, we'd be outside playing all day and then come home at tea time. She can't just do stuff like that. And like even in our garden, I've got the gazebos up and things like that. I don't know, it is our sort of norm for us. So It's gotten to the point where it is normal for us.
Yes.
So it's not really, I don't know, I'm past the part of the struggle in the beginning of not knowing what to do, what sun cream, what clothing, what hats, and all the timings of things, where to go, where I can go, where there's shade. I'm past all that now, so but obviously for somebody starting out, it was stressful for me.
You've got to plan your day
then.
quite carefully.
Yeah, it was very stressful, and I just felt like, I don't know if I've said it on other things and stuff, but there was no other parent I could turn to just to speak to and maybe get their advice. On the Zooms, I did get advice from other patients, but as a parent, there was nobody that could sort of be like, oh yeah, it's the same with my wee one, or I tried this with my little one. That was the hard part. And then if I did speak to somebody who knew nothing about it, they were just like, it's just sunburn. She's allergic to the sun. What?
Yeah.
Like, it's...
You mentioned about normal there. So in lots of ways, I almost like to think of this condition as just being an exaggeration of, I don't like to use the word normal or abnormal at all, but it's an exaggeration of skin responses to sunlight. So for you, Shannon, and for Aria going forward, to think about her not being abnormal in inverted commas at all, but more to be in that, because 20% of the population, that's 1 in 5 people. 1 in 5 of your pals will have this. Maybe a lot milder than Aria does, but loads of people have it and think they never get as far as going to see their GP. They never get as far. And the other thing is, what I do often say to youngsters with light sensitivity conditions, if you use your sun protection, then it also is protective against things like aging of the skin and things like that longer term. So, you know, there are benefits to sun protection well beyond just the light sensitivity. So I think going forward, trying to encourage her to think, actually, no, it's not a disease, or it's more that I've just got a bit more of a reaction to sunlight than maybe some of my pals do. But
I mean, I had no idea that it was that common in the population.
I didn't.
No idea at all.
I didn't know. I knew a few people had it, but well, to me, I'm the only one as a parent. Like, I don't know if there's any other groups out there for parents. I've had a look, but there's no.
Well, you touch on an important point there, and it's something that you know because you've been involved with it, that we've started a few years back, just before the pandemic, actually. We've always sort of asked patients and parents for feedback on our service in terms of, you know, are you having to wait too long, or what the service is like when you come and things. But actually, we realised, with Rod's help as well, that we're missing a trick in terms of trying to find out really, really what matters to patients and to families of patients with light sensitivity conditions. So we've set up a series of sort of patient engagement events. First one was in person in the V&A in 2019, and then because of the pandemic we switched, as you know, Shannon, to doing them virtually. And it's to try and bring patients and their families together to talk about what really matters to you. And it is interesting because although polymorphic light eruption is so common, there is not a polymorphic light eruption patient support group. You know, there are a few patient support groups for some of the other rarer light sensitivity diseases, but paradoxically not for this. So, you know, we're keen to support all our patients and families as best we can. And we're now doing these twice yearly newsletters, and we're doing twice yearly virtual patient engagement events, and we'll hopefully also do some inpatient ones. These podcasts are, you know, a big part of what we're trying to do to raise awareness as well. But it's talking to, like you say, other mums or other parents who've got children. How do you manage with your child at nursery? How do you manage when your child comes home and says, I don't want to meet somebody
who, even though it is quite common, Aria doesn't know anyone who is having to wear it all the time, having to wear hats. So even if Aria got the chance to meet another child,
exactly,
just to even be like, oh, I get that too.
Yeah, exactly. Yes. I mean, we would love it. You know, obviously, patient support groups tend to obviously have a lot of patients involved in doing that. So we're keen to try and foster and support you as patients and families to come together and talk about
Well, hopefully this will be a start.
Yeah, exactly.
They might trigger off some conversations and get that started.
Yeah. The other thing is, so does she take vitamin D supplements or anything?
No, she was never. I had asked about that, but I can't remember what it was, but I was never told to give her them. So I just.
But if you're being very careful about sun protection, it may be worth. So she's obviously very young, so she hasn't had bloods and things done.
No, never.
Often in older patients coming, we will do a blood test and check the vitamin D levels. But because she's young, what we don't want to do is, you don't want to medicalise, at tiny age, give people, children a sort of thing about blood tests and things. But it might be worth, you can get these, even the multivitamins in sort of pastels, and
can you just give them even if she's not like...
Yeah, I probably would suggest a children's multivitamin on a daily basis, the Bassett's sort of blackcurrant pastels and things like that.
She's had them before.
Yeah. But just to take it year round. So vitamin D is a vitamin that is very hard to get through the diet unless you eat a lot of oily fish and things, which, no, exactly, as a 5-year-old won't. No. And actually the main way any of us get vitamin D is through the sunlight on the skin, and in particular the UVB, so really the sunburny bit of the sun. Yeah. So if you live in Scotland, even if you don't have a light sensitivity condition, about half of us will be a bit low on vitamin D anyway. So if you live in Scotland and you're quite carefully sun avoiding, your risk of that is greater. Vitamin D deficiency has been slightly controversially linked to lots and lots and lots of different diseases. The only one that is absolutely clear cut is that we do need vitamin D for our bones. So it's a bit unclear as to how true the link with a lot of other conditions. But certainly for good bone health, we need good vitamin D levels. So it's probably worth doing that. And to take it year round, not just in the summer. Yeah. And then when she's a bit older, we can probably check her levels, but she's not going to come to any harm. And it may help by taking a wee
there's no harm in it.
multivitamin.
Well, that's been really useful. Hopefully lots of useful things to you. And it's been hugely useful, I think, to us to hear your story. And
no, definitely. I mean, there's probably things that I've missed out, but
I think what comes across for me very much as well is you do very much highlight how we need to try and help support in this situation, because there probably is a little bit of a sort of isolating feeling as well, isn't there, when you suddenly think, oh gosh,
you're the only
we the only ones, and things. And
like, I loved coming to the Zoom. I loved that, the fact that I could speak to other people who suffer from it, even though it isn't exactly like Aria's and maybe not the same symptoms, but the fact that it's along those lines, like, that helped massively.
Yeah.
So even them just saying like, oh, she'll be okay, like,
absolutely,
just little things like that. That was just
And so we're going to definitely carry on doing those at least twice a year and things, and
or even anybody starting out in the beginning of the journey and hearing this podcast, or it's good for them, because I do remember going online and researching everything, and I couldn't find much online. Just sort of doing my own investigation of it, but somebody could stumble across this. You never know. And
absolutely. Well, I think one of the things as well is when we did our first engagement event, there were a few things that came to our attention, and one of the things was that actually patients, or parents and children, if it's children, can often wait a really long time to get referred up to dermatology or to photobiology for investigation. And that's for very understandable reasons, really, I think, because often you'll go to your GP or you'll speak to the school nurse or something like that, and it'll be about symptoms that there may be nothing to see at the time. It might be wintertime, there might be no problem. And some of the light sensitive conditions are not particularly common. And with some of our rarer light sensitivity conditions, the average dermatologist, never mind the average GP, might never see some of these light sensitivity conditions. So there can often be quite a lag to getting referred up. So that's one of the things that we flagged.
I did take a lot of pictures of Aria every time it happened. I've still got them there. But the other thing as well is that it's not just so much the rash she suffers from as well, is that she gets very tired.
Does she? During these episodes, is it?
Yeah. She gets really lethargic and grumpy, and that's usually before the rash appears. So I don't know if it's just a fluke or if it is a sort of side effect of it, but she's always very lethargic. And
so until relatively recently, we've always thought polymorphic light eruption for sure was a sort of a skin problem, and the vast majority of patients probably don't have other symptoms other than their skin rash and it being itchy, and they may not sleep very well because it's itchy and it keeps them awake. And there's one very rare light sensitivity condition which Aria doesn't have, called solar urticaria, which we do know patients can feel sort of fatigue and a bit headachy, a bit just generally unwell when they have these episodes. But actually, one of the things, again, that came out of the engagement events has been that for some of the other light sensitivities, when you actually ask those questions, people do say, actually, I do feel real fatigue, or I get a headache. And I think I think as skin doctors in general, we've probably not been asking those questions enough. And it's something that is now on our radar.
Yeah.
Because the other thing we have done is we've put together a red flag card, which is not just for primary care and other dermatologists, but also for patients and families and things, put together in a cartoon sort of diagrammatic way, just a wee poster really to highlight the things to look out for with light sensitivity. And on that, actually, we've added in, at the request from our patient feedback group, to say, think also about asking about things like headache or generally just feeling
feeling a bit like run down. That's kind of the way to describe her, is that she'll feel run down.
Yes, I think it is a real thing. There is virtually nothing published about it in the medical literature.
I think I just noticed because I noticed a change in her sort of not behaviour, because she's not obviously being bad or anything, but I just noticed the difference between when it's a cloudy, dark, dull day and she's not going to get the rash, she's not been in the sun at all. Like, I do notice a difference. Obviously, I'm not sure if that is entirely anything to do with it, but it's just things that I've picked up on.
And can she be caught out on a cloudy day, or?
I've noticed it depends on the UV, the temperature that day. So, like, some cloudy days, like today, should be okay. She's got sun cream on, but she'll probably only have it on once and she'll be out. But then she'll be back inside doing whatever in the classroom.
And how is she in the car?
She's fine. Yeah, she's
not
fine.
All right with the light through the window.
Yeah, no, she's got the thing up on the windows and stuff. She seems okay so far.
And does clothing stop her getting it?
Yeah, stops her getting it. It's mainly just the face. She never gets it on her hands. Her hands are always fine.
Well, that's because she's a bit hard to see on her hands.
Yeah, it's always, here is the worst bit where it starts. It's like,
her cheeks.
Yeah, it's like the school has posted a picture of the other thing that they have that you can go on and look, and I'd seen it on her face straight away. And I was like, oh, she needs sun cream on. I could see it sort of starting to come up. But I think they obviously did put it on her because then she was fine. It didn't.
Yeah. And does the sunscreen help, do you think?
Yeah, 100%. I think for this year she's not had touchwood, no rash, nothing. She's been okay.
Yeah, I mean, the likelihood is as she gets older, she won't get affected on the face.
Yeah.
We do see that much more in the wee ones, the under 10s, really, on the face. And as you get older with it, it tends to be more
then. As well, won't it? So the hardening the skin. Because I do, even though I limit her, like, I'm not like, oh, we can only go out in the morning and that's it. No, I'll let her out and then we'll have a break for a wee while and then we'll go back out, have a break. Like, I don't just let her out once a day.
Yeah.
We kind of just, every day is different. It just depends. So
the typical way, say, in an adult, this might present would be someone maybe going on holiday abroad and maybe on day 2 or 3, they'll develop this prickly, spotty, itchy rash, but usually on bits that they've exposed for the first time that year, so they might get it on their
I am nervous about taking Aria abroad. It's not something I think I can do yet with her. I don't know, because I don't want to risk it. Even though she's got all the things in place to sort of prevent it, but I've never been abroad myself yet, so I don't know what it's like to go. But at the same time, I'm like, I don't want to take her anywhere hot because it might trigger her, and then that would be her sort of stuck in for the holiday. So that's another thing that I've thought about, whether or not to do that. And
so if and when you do go abroad, or indeed for summers here, if you get caught out, we'll usually say as well, have a steroid cream or something. Have you tried anything like that?
She used to get that before, when it was really bad. She would get given that from the doctor.
And then as soon as you get any hint of rash beginning, to put that on twice a day for a few days to try
so
and
that's your fallback.
She used to get Piriton a lot. That was before she was diagnosed, because obviously that's the main thing given if she's itchy or there's a rash. It's Piriton.
So the antihistamines will help her with the symptom of the itch.
Yeah.
They actually will not probably do anything to preventing the rash come on, because we know that histamine's involved in this condition, but it doesn't play a big part. So it would probably help with the symptoms.
Yeah, I think it's more just sort of keeping her protected to sort of prevent her from getting to the point of the rash and stuff, which is, so far we're doing okay, I think. I've managed to get everything in place to sort of, I guess, make it like so it is normal.
Yes.
Like, we're not having to be like, I'm not having to be like, oh, we can't go today because it's
just
23 outside. We can't go.
No, don't stop her doing anything. And have you or anyone in your family got it? Had prickly heat? Or I'm saying prickly heat. I should just say that.
I was going to ask, because I heard that term.
Yeah, most people come and they say, I think I've got prickly heat.
I hate the sun. The sun hurts my skin. I don't know if I've had it when I was a child or what, but I'm very frankly moly and everything like that. I don't know if that's anything to do with it, but if it's hot outside, I'm covered. It stings.
Do you get a rash?
No, but I was very rashy as a child, but they didn't know what was causing it back then. So I don't know if it could have been that. And my mum also suffers from a lot of prickly heat and stuff like that.
And what
so
does she mean by prickly heat?
just the rash. Doesn't look like Aries though.
Yes, but that's why it's called polymorphic, because that means many different forms.
Yeah.
So it can present in a variety of different ways. But the prickly heat is an interesting one, because most people with this polymorphic light eruption, or PLE, as we say, come and say, I've got prickly heat. But actually, so there is a condition called prickly heat, but that's where you get a rash with heat in foldy bits. So in the armpits or the groins or under the breasts or in foldy up bits that get overheated. If somebody comes and says, I get a rash here, and they're pointed to the front of their chest, or I get a rash here and they're pointing to their outer arms, that's not prickly heat. That would be polymorphic light eruption, or PLE. So the vast majority of people with prickly heat don't have prickly heat, they have PLE. So it sounds to me like your mum has PLE.
Yeah, well, once Ari was diagnosed, my mum does think that she had it. But with me, I don't know. I don't like the sun. I don't know. But I never get rashes, but then I'm never exposed to it.
So you could well have it as well, but just not have tested yourself out.
Yeah. So I don't know. I did remember reading it can be hereditary, but I don't think it's very...
It's not strongly hereditary, but if your parent has it, then you're more likely to have it. But it's not a strong hereditary.
Yeah. I don't know. Back then when I was younger, when they did all tests and stuff on me, because I was in and out of hospital, I don't know. Yeah, just they couldn't find out what it was. I think they thought it was meningitis to start with, but obviously they found out it wasn't that. And still to this day, they wouldn't be able to tell me or tell my mum back then what was causing this. I mean, for all we know, it could have been this, and back then we didn't realise, because that's what, 29 years ago, so a long time ago. So I don't know, but I don't like the sun myself. I'm always avoiding it, and
I bet that is for you.
Probably. I have thought that I have had it, especially now with it hurting my skin, like I don't tan or anything. And I think when it was 29 the other week, I couldn't go outside. I was like, no, that's stinging my skin. I'm not. So I don't know if it's just because I purposely avoid the sun that I maybe don't get the rashes and stuff. Yeah.
So you see, you think of yourself as normal. Your mum will think of herself as normal. So that's the way to go with Ari.
Yeah, that's true. Yeah.
That's a good way to
no, it is,
feel treated. Yeah.
If we do have it, we don't even realise what happened. It's just...
The other thing is sunbeds. We find that's often a way that people will find out they have this condition. They'll go and they'll use a sunbed, which of course sunbeds are mainly UVA. They are fantastic at triggering PLE.
I don't use them. I'm too cautious with my skin, so...
And we sometimes also see it present for the first time in people who come up to dermatology to get UVB light treatment for things like eczema or psoriasis. And they'll start their treatment and they'll suddenly get a rash provoked by the light treatment. And that's the first time they realise that they're also part of that 20% of people who have it. So.
Well, I've learned so much. Shannon, thank you so much for taking the time. And Sally, thank you for coming in, and to our listeners. I hope you've enjoyed the podcast, and if you'd like to learn more about them, there are other podcasts that you can access. There's also a wealth of information on the NHS Photobiology website, and these details can be found linked to this podcast that we've done today. So a huge thank you, Shannon.
Thank you.
Thank you so much.